Irritated dry eyes cause discomfort, but when the problem persists, it may be a medical condition that needs to be looked into.
Hi, docs. My daughter works for the show, and I've got a question for you. Why is it that as I get older, my eyes are getting so dry? The worst time is first thing in the morning. When I wake up, they're incredibly dry. By the end of the day, my eyes are so dry and so uncomfortable. I've tried over-the-counter drops, and they really just aren't doing the trick. What is up with that?
Ophthalmologist Dr. Shami joins us to explain what may be going on. Welcome to the show, Dr. Shami.
Thank you so much for having me. And what Michelle was describing here is symptoms that could very well describe chronic dry eye disease. Chronic dry eye disease is a very, very common problem that many Americans suffer from. And symptoms could be burning sensation, irritation, gritty feeling, blurring of vision, not so good, and redness. Sometimes even excess tearing. But what I usually tell my patients is, if you feel your eyes, that's not normal.
Let's look at how moisture in particular works in the eye. There are glands both above and below the eye that produce lubrication, very important. This layer protects the eye's natural moisture. So with each blink, tears spread across that front surface of the eye. Those tears, of course, provide lubrication. They can reduce the risk of eye infection, wash away foreign matter in the eye, as well as keeping it smooth and clear.
Indeed. But if that tear film is unstable and the quality or the quantity of the tear film is not healthy, then the surface can break down, and the dry spots can then cause breakdown of the underlying layers and irritation, and then it becomes a vicious cycle of inflammation.
So what causes this condition and who may be at risk? Tear production can diminish due to contact lens wear, medical conditions, environmental factors, or it may even be a side effect of certain medications you're taking. Dry eyes also are common or more common in people over the age of 50, and it's seen more often in women, especially if they experience hormonal changes due to pregnancy, use of birth control, or maybe going through menopause. Eating a diet that is low in vitamin A or omega-3 fatty acids may also in some cases lead to dry eyes. So adding things like salmon, sardines, vegetable oils, and flaxseed to your diet could be beneficial for those folks.
Absolutely, and hydrating yourself also is really important, as is minimizing the amount of time you look at screens, so the computer, the phone.
No one ever does that. We don't ever look at screens here, do we?
That's one of the most common problems, actually, and that's why a lot of younger people are suffering from this. I'm excited to be here to partner with Allergan to bring awareness to this condition, which unfortunately many times there's delayed diagnosis. If you think you may fit into that category, your eyes are kind of looking red to me right now.
No.
You may want to take a quiz, a dry eye quiz, and you can go to dryeyequiz.com, and it will give you some talking points so that when you partner with your doctor, they can have a discussion with you and start you on the treatment. And if you take that quiz, they donate $1 to Guide Dogs for the Blind.
And I must say that I had the privilege a little earlier of seeing one of our cameras that may or may not have been on a special friend that you brought for us to meet.
Indeed. So we have Boris here and Anne, his handler, who's here from Guide Dogs for the Blind. This is a wonderful organization, and again, if you take the test, you will be supporting the organization that's nonprofit, and if you do so, then more people who can benefit from amazing dogs like Boris can benefit.
Oh my goodness. Can I, before we go, I know you're always supposed to ask, can I say hi to Boris?
Of course.
Hi.
Oh my goodness. Hi, Boris. Thanks for all the good work you do. You're such a good one. You're so pretty. Dogs are officially the best. They really are. And thanks for coming, Dr. Shami. Thank you so much for being here. We'll be right back.